Alright, so we're going to go over allergic reactions, chapter 20. If you guys are ready for some interesting information, hang on. A couple topics that we're going to go over are just basic allergic reactions, anaphylaxis, anaphylactoid reactions, and administration of epinephrine. Immune systems naturally respond to foreign substances in the body. So your immune system is your protective system, your alarm system, basically anything that should not be in your body, your immune system will take care of it. We're going to talk about some of your white blood cells and things like that that help take care of those foreign invaders or pathogens. So we think about an allergic reaction, and a lot of times I think about allergic reactions as just you go outside and you cut grass, you get a little pollen, dust, things like that. You get a runny nose, a stuffy nose, a headache, um, things like that. If you get stung by a bee, you have a localized reaction just to one area. But sometimes you have something that's worse, and it's an anaphylactic reaction or an exaggerated response. The allergen is basically just what is causing that response, whether it be just a basic allergic reaction or an anaphylactic reaction. So the way this works is your first exposure, most times you don't have a anaphylactic reaction. There are some times that you can, and it's called an anaphylactoid reaction. You guys are welcome to look that up. But anaphylactoid means that you've never been exposed to the pathogen before or the allergen before, and when you are, you have a severe reaction to it. But most people, most of us normal folks, we have a allergic reaction. It basically starts off with our immune system. The pathogen gets into our body, and then our body forms antibodies against that pathogen. So the next time it shows up, it's going to recognize it. The second thing that happens once those antibodies are present and you're exposed to the substance again, your body is going to know that it's there. Something called cytokines. Cytokines are like the tattletales in kindergarten, right? You do something wrong and your friend goes and tells the teacher on you. So when the pathogen enters the body, the cytokines notice it, react to it, send signals out, and the antibodies that you've already made against this pathogen will start a chain reaction. And one of those is histamine. So histamine is then released into the bloodstream, and these histamines can actually cause some major issues, although it's trying to protect you. So what do you see from the outside? You start to see some swelling, some bronchoconstriction. So if we were in a live classroom, I would point to one of you guys and say, hey, what does the word bronchoconstriction mean? And of course, one of you would say that bronchoconstriction is when your bronchioles constrict. They get smaller. And vasodilation. So vaso means our vessels. Dilation means they get larger. So as these things start to happen, you'll see a chain reaction. So basic allergic reaction, this all happens in one small area. If you're bitten on your forearm, you'll see some swelling, some redness there, but a lot of times you will not have a major reaction or a systemic reaction throughout your body. So this is the normal effects that will happen once a pathogen comes into your body. Now the anaphylactic reaction, that's a totally different animal compared to just a basic allergic reaction. Anaphylactics is a system-wide. It affects your entire body, and it's a severe, life-threatening allergic reaction that EMTs can play a huge part in taking care of. So it can cause rapid dilation of blood vessels, low blood pressure from that dilation. Your airways will start to swell. So in this case, if you think about your bronchioles, they have the cartilaginous rings around and they have muscle, but as they get further down into the airway, the cartilaginous rings are no longer as strong to help hold the airway open. So not only are those muscles starting to get tight and constricting because of the anaphylaxis and the swelling, but you're also releasing mucus and it's coating the bronchioles in the area. It's just a huge effort by your body to try to trap that pathogen and get rid of it. So common allergens. These are some things that a lot of people may be allergic to. Insects, food, plants, medications, and other things. Number one on the list for medications is antibiotics. That is a huge issue for some people, and it can happen, like I said, the first time you take the antibiotic and you have an anaphylactoid reaction. It's the same signs and symptoms that you will see. It's the same treatment as an anaphylactic reaction. Latex allergies are common, so pretty much everything in EMS now is latex free. Just, as you use things, always just look at the label, make sure it says it's latex free. There's so many people that's allergic to latex that we need to make sure we take care of them. So there's no way to really predict the exact course. Sometimes your allergic reactions can take up to 30 minutes to an hour or maybe even longer before they show themselves. Sometimes it's immediate, very quickly. Some things that you're going to look for on the skin: itching, hives and urticaria. So if you see those two things, basically it's just raised whelps on the skin. Flushing or red skin. Whenever your vessels dilate, it pushes all that blood toward the surface and your skin gets red. Start to sweat or see the water on the skin. Your face could start to swell. Warm, tingling feeling in the face, mouth, chest, feet, and their hands, and that's basically just because it's got the extra blood flow that's rushing to those areas. Whenever you see this patient here, doesn't have terrible amount of swelling, but you can see around his eyelids. You see his face is very red and flushed. So once we get our good history on this patient, we'll start to understand some things that we might need to do or how we should treat this patient. This is a good example of hives or urticaria. If you'll notice, see if I can get my pointer going here. If you notice in this area here, and here, all these raised red whelps, that is urticaria / some other things that we're going to look for. We see the skin now in the respiratory system. They're going to feel some tightness in their chest. It's difficult to breathe. They're going to cough because their bronchioles are starting to constrict. They're starting to get coated with mucus and they're trying to get it out. Like I said, your body is just trying to fight off this pathogen. Your respirations can get rapid, labored, and noisy. You may hear wheezing as a something that you can see as a sign. Hoarseness, muffled voice, loss of voice, stridor. If you hear stridor in a patient that's having an allergic reaction, that is a very, very severe sign, and you need to work fast, rapidly with this patient. So what can you guys do as an EMT for a severe respiratory problem associated with an allergic reaction? So in the state of South Carolina and a lot of other states, they allow EMTs to administer albuterol. So that is one medication that we will spend a little more time on and make sure that you guys are comfortable with the 5 R's, the indications to use this and contraindications. So what's going to happen with your heart rate or your heart? So your rate is going to go up. Your body is trying to compensate. This is like a super critical incident, I guess, discussion that we can have and just talk about how all this is working together in effect to try to get rid of this allergen. So your heart rate's going to go up. More blood's going to come to the areas that the pathogen is in, is trying to take care of. But due to your vasodilation or your vessels opening up, although your heart's beating faster, your system or your container is larger. So your blood pressure is going to go down. So classic signs of shock: increased heart rate, decreased blood pressure. Some other things that you might find: itchy, watery eyes, headache, a runny nose, and a sense of impending doom. If a patient tells you that they feel like they're about to die, take them very seriously. Most times, if they feel that way, they have a strong indication that something bad is about to happen. So again, just some signs and symptoms of shock: altered mental status. We know that whenever our brain is deprived of oxygen or glucose for a very short period of time, we start to have an altered mental status. We're going to look at the AVPU. Alert: are they verbal? Are they painful or unresponsive? Their skin's going to be flushed, cool, clammy. Nausea, vomiting, changes in vital signs. Remember, their heart rate's going to go up, the blood pressure is going to go down, and their respirations are going to increase. So any of the previous signs that we just saw could be symptoms associated with an allergic reaction. When does an allergic reaction turn into anaphylaxis? And here's your answer: when the patient has either respiratory distress or signs and symptoms of shock. So, as we learned last night, we went through, and you guys can understand a little bit more about patient assessment, scene safe, PPE, BSI, standard precautions, whichever words you want to use. How many patients do I have? Do I think I need some assistance, and do I think I need to take C-spine precautions? So those are all things that you initially are going to do for your scene assessment. Your primary assessment is going to take care of life threats. When we think about allergic reactions, we think about life threats. So airway, big word that we've learned is patent. Is the airway patent? Is it open? Is the patient breathing? What is their rate, rhythm, and quality? So we find that sometimes their rate's going to be increased in allergic reactions. The rhythm, it should be normal but fast. And their quality, they could have an abnormal quality if they're wheezing, if they have a lot of fluid buildup in their lungs, things like that. So this is the time where you're going to have to make a decision. Is it just high flow oxygen that they need along with your other treatments, or do they need assisted ventilations? Circulation, do they have a pulse? So they should have a pulse, especially if you're there within a standard 8-minute response time. Like most areas of the country, we're looking at about 8 minutes for response. But you need to look at more than just their heart rate. So we're looking at their heart rate, their blood pressure, we're looking at their skin condition. So these are all things that we're going to be evaluating. Now we're going to move into our secondary assessment. So we've already taken care of life threats. The scene is safe. Life threats, we got some ALS on the way to help us. Our secondary assessment, we're going to find out some more about this patient's condition, and we're going to use our sample, our OPQRST, and some clarifying questions. So, history of allergies. Do you know that you have an allergy to a certain pathogen or allergen? You have an allergy to peanuts. Did you eat peanuts? Were you around somebody who had peanuts? Did you eat something that someone made that may have had peanuts in it, but you were not aware? Exposure. So, how were you exposed? What route? Did you eat it? Did it touch your skin? Did you inhale it? What is the route and the method of the exposure? Signs and symptoms. So we remember that signs are things that we can see. Symptoms are things that the patient tells us. And has it gotten any worse? So from the time that you called, are you worse than you were since we're here? Or, are the symptoms kind of going away? Are they regressing? And what interventions have you taken either prior to us arriving as EMS providers, or what interventions has the EMS providers taken for you? Baseline vitals. So as I told you, we're going to get into all kinds of stuff, and we're going to talk about things that we talked about in chapter 7 or so with vital signs. One set of vitals is a baseline. So you have one set of vitals, you have one set of vitals. Once you get 2 and 3 sets of vitals, you start to trend. So you understand it if your patient's getting better or worse based on their vital signs. And we're going to get good past medical history. We're going to manage the airway. High concentrations of oxygen in an anaphylactic reaction is a good thing. You can place this early and get it started. They are going to need some type of support. The mild allergic reactions may not need oxygen. So if someone's bitten by an ant, they have a little bump on their ankle where they were bitten by the ant, maybe it's swollen just a little bit, but there's no other associated problems, and their O2 sats are 99%, guess what? They don't need an honorable breather. But same person that gets bitten by the ant and his leg swells, his arm swelling, his face is swelling, he's wheezing, and it's getting worse, it's progressing. Yeah, that person needs oxygen. They need a lot of treatment, and we're going to talk about that in just a couple minutes. So, considering assisting the patient with an epi auto-injector. This is a medication that is normally prescribed to the patient by their physician because they have a severe allergic reaction to some type of allergen or pathogen. So, in that, they should know how to use this, but as we said earlier, when your brain's deprived of oxygen and glucose, you have an altered mental status. You're not thinking appropriately. So we as EMTs need to be able to assist the patient in administering the epinephrine. If the patient's not wheezing or showing signs of respiratory distress or shock, continue your assessment and consult medical direction. If the patient has come in contact with a substance that caused the allergic reaction in the past, the patient also could have a respiratory distress or exhibit signs and symptoms of shock. At that point, you would assist them with their auto-injector. Or, in the state of South Carolina, you are able as EMTs, as long as your service allows you to, and you have a standing order for it, you can draw up epinephrine and inject it IM per your local protocol. Once this is done, you need to record that you gave it, what time, and you need to transport the patient to the hospital because they could have a emerging or a relapse of the allergic reaction. The epinephrine basically could wear off. And they need to be reassessed by your standards at least every 5 minutes, but a severe allergic reaction or an anaphylactic type reaction, you're going to continuously monitor this patient. So this is just your secondary assessment, reassessing the patient. We're going to get a mental status on the patient. We're going to get an O2 sat. We're going to get a skin condition, a pulse. We're going to get a blood pressure and some lung sounds. We're going to check the patient from head to toe, and we're looking for signs of regression after you've treated them or indications that the patient is getting worse. Additional hives, more redness of the skin, things like that. Should you administer an auto-injector for a simple allergic reaction? So as we mentioned earlier, you have that ant bite on your ankle, and it's a little swollen at the ankle, but nothing else is going on. There's no urticaria, no hives, no hypotension, no increased respiratory issues or problems. No, you just need to do your regular assessment, offer them transport to the hospital, transport them for evaluation. Now, if you find that your patient is covered with hives or urticaria, they're cool and clammy, they're hypotensive, tachycardic, and have a rapid respiratory rate or tachypnic, that is the patient that we're going to assist with their epi auto-injector. This video, if you
The
will,
immune
I'm not going
system
to play
reacts
it
to
during
any
this
foreign
presentation,
substance.
but if you'll go
Allergic
to
reaction or
your
anaphylactic shock
Pearson
occurs when this
multimedia,
response is exaggerated.
there is under the chapter 20 videos, you'll find this video. So look at that
Some
video.
symptoms of anaphylactic shock can include hives, flushing, facial swelling, itchy watery eyes, runny nose, and rapid breathing. Exposure to an allergen causes dilation of blood vessels, increases heart rate, and decreases blood pressure. Swelling of tissues lining the respiratory system can obstruct the airway, leading to respiratory failure. The presence of either respiratory distress or symptoms of shock indicates anaphylaxis.
Allergic rhinitis occurs when people who are allergic to airborne particles of dust, dander, or the pollens of certain seasonal plants have been exposed to these substances. Symptoms include coughing, headache, sneezing, and itching nose, mouth, and eyes. When an allergen is inhaled by a person with a sensitized immune system, it triggers antibody production. These antibodies bind to cells that contain histamine. When the antibodies are stimulated by pollen and dust, histamines are released. This causes itching, swelling, and mucus production. Symptoms vary in severity from person to person. Very sensitive individuals can experience hives or other rashes. Heredity and environmental exposures may contribute to a predisposition to allergies. The history of the person's symptoms is important in diagnosing allergic rhinitis, including whether the symptoms vary according to time of day or the season, exposure to pets or other allergens, and diet changes. Allergy testing may reveal the specific allergens the person is reacting to. Skin testing, the most common method, includes intradermal scratch patch tests. The goal of treatment is to reduce allergy symptoms caused by the inflammation of affected tissues. The best treatment is to avoid what causes allergic symptoms in the first place, or to take steps to reduce exposure to allergens. Medications include over-the-counter and prescription antihistamines, nasal corticosteroid sprays, and decongestants. Allergy shots, also known as immunotherapy, are occasionally recommended if the allergen cannot be avoided and if symptoms are hard to control.
All right, self-administered epinephrine. Again, these patients are commonly prescribed from their physician. They know they have a problem with a certain allergen or pathogen, and just know that what the epi does, it's like any epi, it is normally produced by your body, but in a anaphylactic reaction, your body is responding to the pathogen, and it's also releasing epinephrine, but it needs additional, it needs some help, it needs a boost. So what this epinephrine is going to do is constrict the blood vessels, it's going to make them smaller, so hopefully that's going to help increase your blood pressure, and it's going to dilate your bronchioles in your lungs and try to help you get a little more air passed down to your alveoli so you can have a good gas exchange. And remember, you need to be authorized by your protocol prior to administering the epinephrine. Some side effects of epi: it will increase your heart rate, which when your heart rate increases, it increases your cardiac workload. When your cardiac workload is increased, you need more oxygen. That is why it's a good idea early on to go ahead and place that non-rebreather at 15 liters and assist with that. These are spring-loaded. We will have a demonstration in class, and I'll choose someone to actually use a real auto-injector, so everyone will get to see how this operates. This is what one looks like. It's a little different looking than the ones that we have. So if you will look at the EpiPen here, EpiPen, and then they will have a dosage on it. So this one is 0.3 milligrams. So that is for an adult. This is a junior. So junior is half of that, is 0.15 milligrams. So try to remember that. That's normally a question that you may see again. So just get the auto injector. A lot of people keep it with them. They keep it in the glove box. They keep it on their kitchen counter. Make sure that you check it for the 5 rights. It's the right medicine. You're going to give it the right routes, the right time, the right dosage. So make sure all those things are checked and evaluated. Always, always, always look at the medicine prior to administering it. Remove the cap. If you don't take that cap off the top, it will not activate the needle. So once you take that cap off, you place it against the patient's thigh, making sure there's nothing in their pockets between the needle and the patient's muscle or their outside skin. You can place this and it will go through clothing, but you want to make sure there's no cell phone, a wallet, change, keys, things like that in the patient's pocket. Record the time, carefully dispose of it. What I would tell you guys, if you're calling ALS and they're coming to pick the patient up, once you use it, keep it with the patient, give it to the ALS crew so they can look at it, get the date, know the time, know the dose, make sure it's for the right patient, and things like that. A lot of times these will come with 2 in a pack. So if you just use one, don't throw them both away. Always reassess your patient. Our standard is 5 minutes for critical patients, but a severe anaphylactic patient that I've administered epinephrine, I am going to continuously monitor them. I'm going to have my eyes on them continuously. If you don't have an auto injector available, just request your ALS like you should have done way earlier in our assessment, and treat for shock. So treatment for shock is basic for EMTs. You're going to put them in a recumbent position or a supine position. You're going to cover them with a blanket and you're going to give them some oxygen and rapidly transport the patient. Again, these are our doses for our adult and our children. And that is it. So just remember, allergic reactions are common. Anaphylaxis is rare. So we have tons and tons of allergic reactions which do not affect the body systemically, but occasionally we have one that does. The most common symptoms in these, just itching, some redness around the area, but patients with anaphylaxis could have life-threatening difficulty breathing and signs and symptoms of shock. Remember, signs and symptoms of shock: cool, clammy skin, rapid heart rate, hypotension, and tachypnea, or rapid breathing. Patients that are in shock, no matter from what cause, they're going to be anxious, very anxious. So they may not follow commands appropriately. So you need to really, really work with them so you can help them. So we talked about that. By quickly recognizing these conditions of anaphylaxis, you can appropriately treat the patient, and you could be the difference between this patient living or dying. So again, we talked about the body's immune system and how it overreacts to the pathogen. Really wish it could just locate the pathogen at the area that it was introduced into the body and take care of it, but our body just, it goes all out. It's all on during anaphylaxis, and although it's trying to help, sometimes it does cause some harmful effects. So remember, as EMTs, you're going to do a very good assessment. There's a lot of things you can do for a patient that's in anaphylaxis, and we will teach you and make sure you understand and how to take care of all those things. The side effects, again, tachycardia, could increase your blood pressure on someone who doesn't have hypotension, and it increases oxygen demand for the heart. So what are some indications for administration of an epi auto-injector? Just think about that. I may ask you guys to send me a little something on that, just as a reinforcement to your training. Some signs and symptoms, again, with the skin, you're going to feel that cool, clammy skin, increased respiratory rate. You may hear wheezing, some stridor from the swelling, cardiovascular system, hypotension, and tachycardia, or rapid heart rate.